ways of hand hygiene. First is to hand rub and second is to hand washing. With this video, I will be showing how to use the soap and water in hand hygiene. The first things you have to do is to stand in front of the sink. Check your both hands and inspect your nails for possible spoiled dirts. And open the faucet and wet your both hands. Make sure that your hand won't touch the surfaces of the sink to avoid the dirts and contamination. Next is to put a soap or liquid soap, at least 2 to 3 drops, just to make sure that your hand cover and kill all the possible dirts and grease. Make a bubble with your hands, moving a circular motion. Make sure to rub palm to palm. The more the bubbles are, the higher the chance of getting rid of the bacteria, dirt, and grease in your hands. Next is to put your right hands above the dorsal part of your left hands and vice versa. Bacteria loves to hide in any tiny surfaces they could hide. Next is palm to palm. Intertwine your fingers and make sure to rub all the in-between finger to get rid of the bacteria. Don't forget your thumb and all the fingers. Rub it in rotational and circular motion. Do it in both hands. This kind of technique using the soap and water, we could getting rid of all the pathogenic microorganisms, and we can provide a safe and healthy services to our patients. Next step is in rotational motion, collapse your fingers together and rub it in the palm of your other hands. Do this in both hands. This technique is used to assess all the possible dirts and bacteria in your nails. This hand hygiene is very important. This is the first thing to do when we're about to contact our patients. Next is the backs of your fingers. Intertwine it with the right hands just to clean the backs of that fingers, and do it and vice versa. And rub also your wrists at least 1 centimeter. Remember that we are using hand hygiene when we are about to contact our patients, doing an aseptic task, after body fluid exposure risk, after we contact our patients, and also includes after we contact our patient's surroundings. Then after that, you can now rinse your hands, both hands. Remember to do not touch any surfaces of the sink to avoid contaminations. After you rinse your hands, grab a piece of tissue paper or towel to pat tap your hands to dry it. Please refrain to harshly scrub your both hands to avoid the damages with your skins. After that, you can now trash that contaminated tissue. Grab a new clean tissue to off the faucet and you're done.